Hello everyone, I am Dr. Anupam here and today we are gonna discuss the second part of our ABG lecture. Today we will discuss the compensation and any additional respiratory acid base or metabolic acid base disorder that can be present in our patient. In the first class we have discussed what is the primary diagnosis by looking at the ABG. If you have not seen that class, please go in the link in the description and please look at that video and come back again to have a complete grasp over this matter. So let us go straight into it. Before discussing, let us understand some basic concept. Metabolic has to be compensated by respiratory, and acidosis has to be compensated by alkalosis, and it is vice versa. If it is respiratory, then it will be metabolic. If it is alkalosis, that will be compensated by acidosis. Correct. Another key concept that you have to remember is a respiratory compensation is quick over seconds to minutes. However, metabolic compensation is prolonged. It takes days, hours, weeks. Right? Because respiratory compensation has to be done by the lungs, and as you know, we can hyperventilate ourselves all of a sudden. So respiratory compensations are very quick, whereas metabolic compensations it takes time because kidney has to reabsorb bicarbonate. So kidney will take time, it will take days, hours, weeks, but respiratory compensations are very quick, seconds to minutes to hours. Right? Another key concept that you have to remember is carbonic acid. So this bicarbonate actually base. If it is more, then it is metabolic acidosis. If it is less, then it is. If it is more, then it is metabolic acidosis. If it is less, then it is metabolic. If it is more, it is metabolic alkalosis. If it is less, it is metabolic acidosis. Right? And then another thing is CO2. CO2 is called respiratory acid. If it is more, then it will produce bicarbonic acid. If it is less, then it will come back in the opposite direction. So if it is more, so there is respiratory acidosis. If it is less, then it is respiratory alkalosis. These we have discussed in our first class. So now we'll go straight into the compensation. So first we'll discuss about metabolic acidosis. So we have discussed in the last class, if it is a metabolic acidosis, the next step is to find out the NN gap, then divide the metabolic acidosis in two parts. One is high NN gap acidosis and is normal NN gap acidosis. Then what are the differential diagnosis of high NN gap metabolic acidosis we have discussed, and if it is a normal NN gap, what to do next, that also we have discussed. Now we'll see, if it is a metabolic acidosis, then there has to be some compensation by respiratory and alkalosis, and whether that compensation is adequate or not, that we will discuss. So as you have discussed, if it is acidosis, then it will compensate by alkalosis. If it is metabolic, then it will compensate by respiratory. So respiratory alkalosis, so there will be some change in the CO2 level only. So that we will calculate. It's called expected P CO2 level. And what is that formula? This is called Winter's formula. That everyone you have to remember. That is 1.5 into bicarbonate plus 8 plus minus 2. Right. So this is the formula of expected PCO2, and you will have an ABG strip along with you. In that ABG strip there will be a bicarbonate level. That bicarbonate level you have to put here and calculate the expected PCO2. In that same ABG strip that you are having in your hand, there will be a level of PCO2. That is actual PCO2 in the ABG, and this is the expected you will find from this formula. So now manipulating those two PCO2 level, you will find expected PCO2 is equal to actual PCO2. This is calculated using this formula. This is on your ABG strip. So if this is there, then it will be called compensated metabolic acidosis. Right. Now another thing can happen. This is the first point. So there will be a second scenario where you can find the actual PCO2 that is in your ABG strip can be greater than the expected PCO2. Now because it is a metabolic acidosis, there will be hyperventilation and carbon dioxide will be washed out to compensate. But if actual PCO2 is more actually than expected PCO2, that means what? That means the respiratory compensation is inadequate. The respiratory system is not able to hyperventilate and get rid of the extra CO2. So there is an additional respiratory acidosis. So this will be called as metabolic acidosis with respiratory acidosis, the diagnosis, right? So there can be a third scenario where you will find the actual PCO2, again it is your ABG strip, will be less than the expected PCO2. That is calculated from this formula. It will mean we have an additional respiratory alkalosis. So this will be metabolic acidosis with respiratory alkalosis. PCO2 is actually less than what we have expected from this formula. That means the lung is washing out PCO2 more than what it was required to do. So that means there is some other pathology which is driving the patient to hyperventilate more to produce another respiratory alkalosis, right? So this is about metabolic acidosis. Now next come to metabolic alkalosis. So in metabolic alkalosis, what will be the compensation? For metabolic it will be respiratory, alkalosis it will be acidosis. So the body will compensate by producing a respiratory acidosis, right? So here also respiratory acidosis means PCO2 level will go high. So here also we will have expected PCO2 level. And what is the formula here? The same inter formula but in a different format. It will be 0.7 into bicarbonate plus 20 plus minus 2, right? So in your ABG strip you will find this bicarbonate level, and in ABG strip there will be an actual PCO2 like here. So first scenario will be expected PCO2 is equal to actual PCO2. This is calculated By using this formula, this is in your ABG strip. If you have gotten PCO2, that is actually we are expecting from using this formula, then this is called compensated metabolic alkalosis, right? So second scenario will be same like here. We'll find if actual PCO2 is greater than expected PCO2. Now because there is a metabolic alkalosis, the body will try to produce a respiratory acidosis to maintain the pH in a normal level, right? So PCO2 will increase. Then we have an expected PCO2. If the actual PCO2 is more than the expected PCO2, that means the CO2 retention is more than what is required. So that means it is metabolic alkalosis plus respiratory acidosis, right? Third scenario, if actual PCO2 is less than expected PCO2, that means the body cannot produce an acidosis to compensate for alkalosis, then it will be metabolic alkalosis plus a respiratory alkalosis, right? So now we'll see. So there is a primary disorder, metabolic acidosis, and we have found out a secondary problem in them. Whether there is a third problem is there or not, that now we'll find out. It's called delta gap. Delta gap is equal to delta anion gap divided by delta bicarbonate. Now in different book you'll find 0.4, 0.4 to 1, 1 to 2, more than 2. It is very difficult to remember. You forget all the things. Just remember the delta anion gap change should be equal to delta bicarbonate change, right? Should be equal to 1. Consider this as a normal. Now, if scenario 1, so this can be two scenario. In the scenario 1, if the delta gap if more than 1, what does that mean? That means the change in anion gap is actually greater than change in bicarbonate. What does that mean is we have extra bicarbonate in the blood. So this means change in anion gap is more than change in bicarbonate. What does that mean is we have extra bicarbonate in blood. What does that mean? We have a metabolic alkalosis, right? So if the delta gap is less than 1, then change in anion gap is actually less than change in bicarbonate. That means we have less bicarbonate. Whenever there is a less bicarbonate, this is metabolic acidosis. This is as simple as that. You don't have to remember many formulas. Calculate the delta gap. If it is more than 1, you have a metabolic alkalosis additional. If it is less than 1, we have metabolic acidosis additional. So we have found out the primary. This is the number 1 disorder the patient is having. Secondary, we have this is a second disorder. It may not be there, it is compensated only. And there is a third, this metabolic acidosis alkalosis used by calculating from delta gap. And this is only valid for acidosis, that is high anion gap acidosis, correct? Now we'll come to a respiratory acidosis or respiratory alkalosis. So here also two concepts to remember, because respiratory compensation take time. Right. So what will happen is for acute respiratory problems, because it takes time, so the acute problem won't be, there will be less compensation by kidney. What does that mean is there will be more change in pH and less change in bicarbonate. In chronic respiratory problem, more compensated. Chronic means it has taken days to weeks, so there is more compensation by kidney. So less change in pH because it is compensated, and more change in bicarbonate level. Correct. So you have to remember these things to have the concept clear. So now if you discuss regarding, first we'll discuss acute. So acute respiratory acidosis. Right. So remember this formula. Respiratory acidosis means there will be CO2 level will be increased. So for each 10 increase in PCO2 level, more change in pH, the pH will decrease by 0.08, and bicarbonate will increase by value 1, because if it is a respiratory acidosis, there will be metabolic alkalosis, bicarb will increase, right? If it is a acute respiratory alkalosis, then for every 10 decrease in PCO2, pH will increase by 0.08, and bicarbonate will decrease by 2. So we have discussed acute first, because in acute bicarbonate change will be less, only 1 and 2, and pH will be more, 0.08. Now coming to chronic respiratory problems. For chronic respiratory acidosis, what will happen? Same thing, for increase in 10 PCO2, now because it is a chronic, the pH change will be less. So pH will decrease by 0.04 only, less than here, and bicarbonate will increase by 3. Because it's chronic, then bicarbonate change will be more, because now kidney is trying to actually working. And the last, for chronic respiratory alkalosis, for each decrease in 10 PCO2, pH will increase by 0.04, and bicarbonate will decrease by 4. Because so our concept is clear now. If it is a chronic, pH will decrease less because it is more compensated. How it is more compensated? Because bicarbonate change is more than in acute problems. In acute problem also you have to remember acidosis comes faster than alkalosis, even alphabetically also. So this is the thing you have to remember. So today we have discussed a very important concept. First you have discussed very few concepts, then you have directly come to metabolic acidosis, finding out the additional secondary disturbance if it is present or not. in metabolic alkalosis also, if additional disturbance present is not, then we have found out in metabolic acidosis whether there is a third acid-base disorder, it's called delta K, if it is present or not. Then we have discussed about the respiratory compensation. Sorry, it will be metabolic compensation. Sorry. Metabolic compensation. Then we will discuss about the metabolic compensation in different respiratory acidosis and alkalosis problems. Thank you very much.